Hey everyone, welcome back to the Wellness Lab, the podcast that teaches you how to create your own wellness equation. Today, I have the honor of interviewing Dr. Jaquel Patterson. She is a phenom, by the way. She's got so much background and knowledge in medicine, in holistic wellness, and psychedelics, and psychotherapy. You name it. This woman knows how to do it, and she really knows how to get you to living a life with more health and wellness, which is why she's on this show today. I think at the end of this, you're really going to see how mental health and healing are integrated and how they go together and they're not separate, and how the mind really controls what our body experiences. And you're going to see how much control we actually have over our own health and wellness through the way we think and the way we live our lives. We have so much power and so much sovereignty over that. And Dr. Jaquel goes into that deeply. So yeah, my guest today, she's a naturopath physician. She has over 16 years of clinical experience. She's a 3-time best-selling Amazon author. She's been in Forbes, and she's one of the most respected voices in integrative medicine. So if you are interested in holistic wellness, if you're a member of the show, you know, I know you are, just as I am, dive in and let's go deep and let's find out how much control and how much impact we have over our own health and our own wellness through the way we think and the way we live in the world. Enjoy. All right. Welcome back to the Wellness Lab, the podcast that teaches you how to create your own wellness equation. Today we have Dr. Jaquel Patterson. Doctor, how are we doing today?
Good. How are you doing? I'm glad to be here and on the show in the Wellness Lab. So excited for our conversation today.
Yeah, absolutely. Same. I mean, I was researching you before, and I was, we were joking off screen. Like, I didn't even know what you do because you have so many certificates. You have an MBA. You're a naturopath doctor. You study in psychiatry. So I had to even ask you off screen. What do you do? So I'm really excited for everything you bring to the table. And
I'm the perpetual learner. I think anyone in this area of wellness, you're always wanting to learn the new thing all the time. So.
Mm-hmm. Absolutely. Well, cool. Well, let's jump in, and I'd love to learn a little bit about your story, and I know our listeners would too. So before we get into the science and all the the depth, can you share a little bit about what drew you to the mental wellness side and to be a naturopath? Was there like a moment, or was there a patient, or was there something that really made you say, I want to go more of the natural wellness side than the traditional medical side?
Yeah, I think I'd say a series of moments for me. I was always interested in alternative medicine. I didn't know what it was called at the time in terms of naturopathic medicine. Actually, in fact, when I went to college, undergrad, my major at Cornell was initially plant sciences because I was interested in herbal medicine. And so I didn't want to go in the convention. I knew that wasn't the fit for me. And also when my mother, when I was around 15 years of age, my mother got really sick with lupus. They couldn't figure out what she was sick with. And so during that time, I think it made me more disillusioned with the conventional medicine model of like looking at her as a whole person. And she just kept getting tacked on more and more illnesses. So I just knew for me personally, that wasn't like a place that I wanted to. I think there's a time and place for everything, but for me, that wasn't the realm of interest that I had. And so I learned more about naturopathic medicine later after I was working kind of in the business realm within actually the food industry. So I feel like I was trying to get it in my like roundabout way. And so when I learned about it, I was like, this is exactly what I wanted, and went back to naturopathic medical school. And so over a series of time, when I was actually in high school, my mom was ill. I personally suffered from like OCD. That was, in hindsight, this was much, at that age, you don't get it. But that for me was how I probably dealt with coping with instability in the house, because I essentially was her nurse. I was the caretaker for my younger siblings at the time. And the thing that I did have control and order of was, cleaning and putting things in a certain way. So OCD was one of the things I struggle with, as well as anxiety. Anxiety tends to be a lifelong piece for me, but I definitely would say like have come way far along from where I was like in college at the time. And so personally, one of my areas of focus and practice is integrative psychiatry, but I also have a focus on complex chronic illness, particularly Lyme disease and tick-borne infections. And of those people that have these infections, many of them struggle with mental health conditions. And for some of them, it's like the first time they got diagnosed with a mental health condition, or they had a mental health condition and it got worse after they got COVID or some infection. And so basically over time, during my tenure, they always say there's no mistakes you make in life. It's like all these different experiences like built
Mm-hmm. Mm-hmm.
upon themselves, because I myself had struggled with both of them. But then there's now this just preponderance, this increased growth of mental health conditions, particularly for younger people, since 2020. And so it's
Yeah.
been an honor to be able to work with people in their journey towards health, and also look at them from like a root cause of care, rather than just like seeing them only for their mind, or it's only in your head. There are other
Mm-hmm.
pieces that can contribute negatively to mental health conditions.
Yeah, no, I appreciate so much what you're saying, and
Hmm.
your story is, reminding me of my own story too, of getting into wellness in a similar
Hmm.
way. When I'm stressed, I clean the house, and it's like, oh, that's a sense of control,
Hmm.
and it helps me reduce my anxiety, right? And my wife is like, "Why are you doing the dishes?" I'm like, "It makes me feel better."
It does. It still does.
It still works, and I'm like, "Yeah, it's never about the dishes, is it?"
Exactly.
Can you go over what's the difference between an MD and an ND, kind of like high
Yeah.
level, so we can kind of unpack those and we can go to kind of deeper into the ND side.
Yeah, I love you. Thank you for, I love that question, because one of the things is, so we have a naturopathic medical school. We actually take all of the same, the science classes, like the basic science classes. In the last 2 years, we have 1,200 clinical hours. But the focus is more, I'd say, philosophically on how I always explain what we do is like detectives, like
Mm,
why? It's not just, okay, you have a thyroid condition, we're going to put you on medication. Like, what started before? Like a lot of my patients, let's say thyroid, I just mentioned that, after they
mhm,
have a baby, is hormones at play? Is there stress as a result of play? What's the person's gut microbiome and terrain? So we're looking at all of those. So our philosophy is completely different, but we do a 4-year medical program. We have 2 licensing exams that we have to pass, just like you would in conventional medical school. But the difference is the focus is really on integrated medicine. Course requirements are exactly similar. Residencies depend. Some do residencies, some don't. So I would say like there's more time in conventional medical school where they're in residencies and fellowships for a longer period of time. And just philosophy is different. But I would say a lot of people now are getting trained in conventional medicine, and they're going now to what's called like functional medicine. So they're getting a functional medicine certification, or basically exams, after they finish the conventional medical track. Whereas naturopathic doctors, we learn it from day one of our
mm,
first class, like in anatomy. We're going to be learning it from that perspective. So I always say that naturopathic medicine is like the OGs. I always say we're like the OGs of functional medicine,
mm,
because
mhm.
because we're trained to think in a certain way right from day one of just our just basic core science classes that we take.
Yeah. So in essence, we're treating the whole person. That the systems aren't separate; they
Hmm.
work together, and that's actually something I've struggled with when I go to a doctor. And I
Hmm.
know a ton about wellness, nowhere near as much as a doctor, but I struggle and I go, for example, my cholesterol is high right now. And my doctor goes, "Well, hey, you don't need to change your diet. We can just put you on a statin."
Yeah.
And I was like, "Wow, like that's our first answer.
Hmm.
Like not exercise, not nutrition, not stress. We're just don't make any changes and let's throw you on a statin," which I know and has downstream effects too, of other things that'll show up. So I just appreciate the fact that they're teaching you from the beginning to look at the whole person.
And we
Can
also
we,
learn nutrition. And sorry, Nick, also the thing is like
no,
nutrition, like what you just mentioned, your example with cholesterol. We take many semesters of nutrition classes, for example.
mhm.
And if you look at conventional medical, they might take, unfortunately, like 16 hours in their whole time that they're there. So part of it is also we're trained to be able to have that conversation
Mm,
about lifestyle. If you're not trained to have that conversation, of course you're going to just recommend what you know. I mean, that's natural. But if you know all those other
yeah.
pieces, you're going to say, wait, this might be able to lower it 15 or 20 points, based on lifestyle and changes, and you're going to be able to support that. But if you're not trained in it, you can't really do that in the same way that we would be able to.
Yeah, I've actually coached many of doctors and many nurses in
Mhm.
nutrition, and I always
Oh, you
find it so
have.
funny. Most of them don't know much about it.
That's why.
And as you're talking about like the intersection of the mind and the body and treating the whole person, and you mentioned that mental wellness and mental disorders are on the rise, right? Probably at a
Mhm.
catastrophic pace.
100%.
When someone walks in, like with depression or anxiety or ADD, what's the first thing that you look at that maybe a conventional doctor wouldn't?
So I'd say when you see a naturopathic doctor or functional medicine practitioner, you're typically from the first visit, first of all, we usually spend more time with the patient. So that's one of the
Mm,
challenges in the conventional healthcare model, not because of the doctors, it's really the healthcare system. We have 15 minutes, right, to see somebody,
yeah,
10 or 15
that's it,
minutes.
right?
Yeah.
Yeah.
So if you have 10 or 15 minutes right there, I always say it's going to take what, 6 visits before you kind of learn the patient. And by then, that's probably been like 2 years. And that's why one of the reasons patients come to see us, I feel like they've seen 7 to 9 doctors and no one's answering
Hmm.
these types of questions.
Hmm.
Yeah.
Yeah, to share, my wife for 5 years had debilitating stomach problems, right? And she's going to
Hmm.
doctor after doctor after doctor, and they're giving her different things, and they're going, "We don't know what it is. We can't help you." And then finally, I got her to go to a naturopath, and the naturopath said, "Oh, you've got she's had to go on a FODMAP diet, right? So she's has
Hmm.
what is it called?
SIBO.
Yeah, she has SIBO,
Okay. Yes.
right? Yeah, and so they put her on some herbs, um, and within a month, her gut health transformed. And it was years of being frustrated and crying and
Hmm.
pain and feeling lost. And it took going to a naturopath to say, "Hey, did you look at this?" And I'm just kind of, I get shocked, like how obvious it can be, if the doctor's looking for the right stuff, it sounds like.
Yes, and if they have enough time, because many of the patients
Mm,
you just get sent to a whole bunch of specialists. Like when I had Lyme disease, I got sent to 2 different rheumatologists. I got sent to internists. End up getting thrown around and extra blood work, and they're looking yeah, they're looking at it from their view, and then you're just kind of stuck.
mm,
Yeah. Oh,
hmm.
sorry, I think there was a delay. So basically you end up getting this piece where you go to a lot of specialists. They all meet with you for 10 or 15 minutes, and then you kind of leave out without an answer. And I'd say what we do is we spend a lot more time with the patients. We might be spending 30 or 45 minutes for like the follow-up with the patients. And then the initial visit might be 60 to 90 minutes. So when I'm seeing someone, I'm looking at everything. Like in the assessment. So when we do, to your question about what we do, we would do a lot more comprehensive blood work. So I'm going to test like their nutrients. What is their magnesium like? What's their iron? You'd be surprised at how many patients, especially my female patients, are iron deficient. And what does iron
Hmm.
deficiency cause? It causes brain fog. It causes fatigue. It can cause palpitations. It can cause dizziness. It can cause like these POT symptoms. It can cause so many other issues that people don't realize, or hormones. Like if your testosterone's low, it's going to be harder to focus, get things done, and there's going to be a
Hmm.
lack of motivation, because testosterone, for example, is connected with like dopamine, norepinephrine, epinephrine, the same neurotransmitters that are impacted with ADHD. So we're going to look at all of those things. Their hormones, a full comprehensive panel of the thyroid, not just the TSH, but like free T3, total T3. We're going to look at their adrenal glands. What's their cortisol like? So you can do that all through the basic conventional blood work. And then I might do specialty tests based on like other things that come up. I might do like a stool test. I might do a neurotransmitter test on like their brain health. I might do metal testing depending on their exposure. So we're looking at like environment, we're looking at lifestyle, we're looking at obviously if there's any like functional nutritional issues, and then obviously we're ruling out like major, like someone might have hypothyroid or hyperthyroid, and that's causing some of the issues they're having. So we're looking at the conventional, but all the other factors that might be negatively influencing health. And so you're only going to get that by sitting and spending time with someone over time to kind of get that full history, which unfortunately the model isn't built to be able to do that fully right now.
Mm. Yes. So what it sounds like you're saying is you're not treating necessarily the effect. You're actually looking at what's the cause,
Hmm.
which is flipping it on its head of what the majority of doctors and the healthcare system is doing these days, right?
Exactly.
Hmm. Why why do you think that the model is set up to treat the effect and not the cause?
I think honestly, to be honest, I think it's easier. I think it's
Mm.
easier to treat the
Hmm.
effect, and that's why I know some of what we're going to talk about today, like if you look at like psychedelics and pieces, like it's easier to do one thing to think that we're going to fix all of it, versus looking at all those pieces, that all of these little steps get to having good health ultimately. And
Hmm.
so it's a lot easier. If someone has very limited time, it's much easier to come in and just give them a quick medication, or even it can happen in functional medicine, a quick supplement to make them feel
Mm.
better, versus asking all the other questions about the whys.
Is it easier to train the doctors as well to focus on one thing rather than multiple things?
Oh, 100%. Because in order to think of
Wow.
multiple things, you have to be, thinking in a problem solving way to think, can it be something out of my wheelhouse? If I'm a specialist, like I'm almost only focusing on rheumatology, for example, I'm going to be checking autoimmune markers. I'm going to check CRP, ESR, their complements. I'm going to check, rheumatoid factors, et cetera. I'm not necessarily going to then go look up I keep mentioning thyroid for some reason. I'm not going to look at their TSH. I'm not going to look at their lipid panel. I'm not going to look at, well, I may look at kidney function, but I might not look at some of these other things that if you were looking at, let's say, neurology, you're not going to be looking at B6, B12, like other things like that. You're just going to be focusing on your wheelhouse. That's a lot easier because it's so overwhelming. The human body is so complex,
Hmm.
right? But what happens is we're then missing out on these other factors. There's been so many patients I've seen that haven't just gotten some basic blood work looked at because they're only seeing, let's say, an endocrinologist, and there might be other factors that are contributing to their health, but they're only looking at it from that one lens, because of complexity. It just can become so complex with just one disease condition.
Mm. That's actually that's enlightening to hear
Mm-hmm.
because part of me as a wellness practitioner is going, why aren't doctors more studied in other areas and have deeper knowledge? But
Mm-hmm.
the way you're describing it actually makes me have more sympathy, more empathy of it's a big ask, it sounds like.
It is a
And
huge
it's a
ask.
longer process.
Yeah, it's a much longer process, and it's a harder to do in the limited time. And for me, I've had the benefit of I worked actually as a healthcare executive for over a decade and
Hmm.
practiced part time, and then had went into practicing. I've been practicing a total of 16 years, but like completely leaving corporate and going to practicing and running a pretty successful multidisciplinary practice with 8 other doctors. That was about 8 years ago, and I was involved in really helping to make some of those models of integrated care in these larger places. But it was really, really hard to change when the model, it's like sick care, it's like the model
Yeah.
pays for fee for service. It's not paying. They're trying to do that, but it still hasn't really worked on like quality. Like, how do the metrics get? Are the metrics better? Are they reimbursed at a much higher rate for that? They've done it, but it's not enough to have that incentive to really change that full model of care to do it the right
Mm.
way.
And I'm wondering if it's harder to track the ROI as well. Like, hey,
Mhm.
patient A came in, they had low iron, and we put them on iron supplement. Now they're no longer anemic. Rather
Exactly.
than, well, this was connected to something else. When then we changed their food, we changed their lifestyle, and then 6 months later, the person was healthier. That seems like almost more like an intangible way of measuring things compared to like a tangible way.
That is a really good point. Like, how do you measure 10 factors to health? And then is that correlative, or is it truly connected when you have, when you look at science, it's comparing it up against one thing, not
Hmm.
10 other factors. So that can make it more complicated for sure.
Yeah. Where do you land on that with, how much is correlated to the mind, the brain gut connection? I've seen studies now that say that up to 90% of disease is
Hmm.
preventable through lifestyle and wellness, and nutrition. And where do you land on that?
Yeah, well, it's funny that you just said 90% because there are studies that show when you look at mental health, 90% of the neurotransmitters are showing located in the gut. So it's definitely a gut brain
Mm.
connection. They call it like leaky gut, leaky brain. And so you look at serotonin, 90% of serotonin in the gut. You have GABA receptors in the gut. So you have also just vagus nerve in terms of like that flight or fight piece, the parasympathetic, sympathetic. So you have some of those immediate factors, but then you actually have neurotransmitters there that can actually impact, like when you look at GABA or you look at serotonin, those are inhibitory neurotransmitters that help with anxiety. And so you'll see most people with anxiety, there's a connection with IBS, You look at
Hmm.
patients with depression, there are higher rates of inflammatory bowel disorders, IBDs, like Crohn's and ulcerative colitis and celiacs, higher rates of things like depression. If someone is inflamed, typically their gut is going to be impacted, their immune system is going to be impacted. And so if their gut's impacted, you'll see also what they call leaky gut, and then you have leaky brain. That blood-brain barrier is also impacted, where these inflammatory markers can affect areas of the brain that are connected with anxiety and depression, like the prefrontal cortex for decisions, hippocampus for memory, amygdala for the fear and emotional regulation. So
Hmm.
all of these pieces are completely connected. But at some point, I'm not against 100% not against like conventional. I think sometimes you're going to need that. They always say in like naturopathic medicine, they call it like the therapeutic order. So there's like a pyramid where like that baseline on the bottom is like the foundation, what they call like the terrain. So that's like your lifestyle, your exercise, your gut microbiome. And then as you go up higher in the terrain, you might, a higher level of complexity, you might need a heavier hand. The
Hmm.
highest is like surgery, and then we're going to go a little bit lower. You're going to need medications, even in the middle might be supplements. So there's different levels depending on where somebody is in their disease state. Even when I'm working with someone naturopathically, you'll see patients that come in and they have 30 bags of supplements, like 30 supplements they're taking. And sometimes I'm
Hmm.
working on like, are you really, and they'll say they're cured. And I'm like, are you really cured if you're taking 30 supplements? You're not, like,
Mm.
are we missing something? Because that can get, we want to be able to withdraw the list and have as many things that are necessary, not necessarily using it almost exactly just like medicine where you're on so many things at a high dose. So I've had I've had patients where we've worked on the gut only and their mental health conditions get completely better, like with
Mm.
anxiety.
Hmm.
Like I work on the gut, we do a stool test, we fix the gut, and they no longer, their anxiety is significantly reduced. So there is definitely connection, and for everybody it's different. And this is where the care is really individualized, because some things move the needle in a different way for different people. Some people it might be an environmental burden like mold or metal exposure. For some people it's like the gut. For some people it might be, we really need to spend more time on their neurotransmitters and balancing that before we even get to the other pieces. So everybody is uniquely different, which is what makes it also harder to practice the way we
Hmm.
do as naturopathic doctors too.
Yeah, there's no panacea. It sounds like what you're saying. There's no one size
Exactly.
fits all for it's what does this specific patient need, and also like in this moment or like in this river of their life.
Hmm.
In my 40s, I'm finding my body's getting much more sensitive and less tolerant of things, and I'm
Hmm.
having to really change my nutrition, which things I got away with in my 20s and 30s just aren't working anymore. Um, are there um, are there big levers that you suggest that patients focus on? There, like you said, there's so much. There's exercise, nutrition, there's sleep, there's supplements, there's cold plunging, right? There's sauna. What are the? I almost feel like there's so much information out there that it can
I
create
know.
paralysis in the average person. What are your big levers that say, hey, do these things more often than not, and they're going to lead to higher levels of health and wellness?
And I love that question, Nick, because that's the struggle. I mean, I have that still personally, in terms of the biohacking. I love any of those like red light therapy, sauna, cold plunge. Like personally, I love that. And when you see all these things online, it could be easy to be tempted to do all of them. But what I always say is like, what is the thing that you can actually commit to doing consistently? Because if you look at in health and
Mm,
actually in life and work and business, consistency is more important than anything, that compounding effect
yep,
over time. And so if you're going to
agreed.
do something, yeah, like exercise, I'm like, okay, that's great. You worked out with the trainer for this week intensely, but are you going to be able to stick to doing that forever? What is actually going to be manageable? Like, so for me, for example, I have a 4-month-old right now. So I'm exercising and I was like, I want to join. I love HIIT workouts. I love group classes. I love pretty much someone yelling at me. I was a former athlete, so we like to, it's like
Hmm.
I love the
Yep,
intensity, but
we're
I'm
sick.
realizing, yeah,
Still in there.
I'm realizing that's not going to work for me at this time in my life. So what do I
Mm,
have? I have
mhm,
my Peloton. I bought my weights. I bought what are the stuff that I could do at home, even though that's not a place I enjoy doing it. I know that that's something I can do like every single day. Same as like walking, I know I can commit to doing that with some sense of regularity. If it's food, being mindful of not doing these extremes, unless that's something like you really, really enjoy and love and, you can commit to. Maybe it's just like, half a plate of vegetables to begin with. Maybe it's like, hey, I overeat. I love to eat. So it's like, okay, how do I cut that amount down 20% instead? Like that's something I know I can commit to. So I think more important than anything is we have these things, but what are the things that you enjoy doing that that you can do that don't feel like these huge monumental shifts for you to do? Because those things won't last past, 2 or 3 months.
Yeah. Yeah. I love that. On the last episode we did, my guest, Dan Millman, said, and it's an old saying, but he said, a little bit of something is better than a whole lot of nothing.
Oh, I love that. Yes.
And it sounds like what you're hinting at of we need to do things that we can consistently do for exercise, right? I own a couple gyms and it's like, can you come 3 times a week? Right. And someone's like, well, I want to come 5 times a week. I'm like, you're coming 0.
Exactly. So how are you going to go?
Three is a 300% increase. Like, show me you can do 3 a day for 3 months, and then we'll talk.
Exactly.
Because the person that goes from 0 to 5, I find they burn out, and then a month and 6 weeks they're gone.
Exactly.
Or they get injured, right? And that's just kind of a
and
metaphor.
That's what used to happen to me. I always got injured. So after I pushed myself too much.
Yeah, and that can be the same for nutrition, right? You see people do Whole30, and then day 31, it's whole pizza because it's not sustainable.
Exactly. Like they oh, now I can, have my party and then they just go back to the same ways that were before. So it's like, I don't like anything that's extreme. And it's actually interesting because I feel like the way the current and just the way the environment is in the world, we're such in a fast paced situation, and time I say is like more important than anything, even now with people doing like a lot of our patients do telemedicine. Why? Because it's convenient to fit into their lifestyle. So time is at such a premium. So anything that we can do that's going to make it healthy, that also increases the benefit of our time, that's going to be something that we're going to, to me is going to be really important to support.
Yeah. How much of that telehealth though is feeding into this like instant gratification culture, and I want to be healthy and I want to be fixed now, but I don't want to put in the work? I know with my own coaching clients, them taking an hour out of their busy day might be more important than the coaching call.
Oh yeah,
because
100%.
they're so busy, and it's like, hey, you actually had to restructure your whole entire life to take time for yourself. How much of that telehealth is actually playing into this kind of sick culture that we've developed through social media and having everything at hyperspeed? I'm just curious your thoughts on that.
Yeah, I agree. I think so. Some benefits. So sometimes I think engagement could be harder for the doctor and also for the patient. I think the patients always have felt good about the engagement with me with telemedicine. And one of the reasons is we make it feel like as soon as you leave, someone calls you. As soon as you get off the phone, there's like more touch points. So that's the one thing, so that we don't lose that like personal connection. But so I think one of the sides is like, we need to make time for health, but at the same, on the one plus of having telemedicine is people are easier. They're more easily able to engage. So normally what someone could have done is instead of going in person, they would just cancel and then they might not come back for weeks. With telemedicine, it gives you the option. Like I have a lot of patients, it's kind of like 50-50. Like they prefer to come in person, but hey, if something comes up, now they can do this and they don't fall off track. So I think the positive thing about it is that it helps to encourage like increased compliance because it's more accessible and the frequency is easier. You're more easily able to do it versus coming in person. So there's like kind of pros and cons to that, but sometimes people feel less, I know me personally as a patient, I could feel like I'm a little bit less compliant if I'm not seeing somebody like face to face. And that's why I think it's the onus on the other person to make sure that person can feel engaged in the same exact way that they can do when they're in person.
Yeah. Yeah. It's interesting. I'll have to chew on that more. I know for myself, like with my therapist, I go in person every time because there's so much power in that.
I agree.
And even just setting aside an hour of my own life for myself,
you're saying something to yourself about like the importance of it. Same as sometimes I have patients and like young people actually do teas. When we look at mental health, I'll do passion flower tea is one I love. It's an herb that helps. I always say it's like if there's a radio in the head.
Mm,
Valeriana is one that's like stronger, sedating for sleep. Chamomile is one that's like gentle. I love to get people to drink teas and things like that at night. That because it creates. I'm like, it's almost like you're giving yourself a treat. Like you're telling yourself when you're drinking tea, like I'm doing this tea, I'm doing something for myself. So it's the same
mm,
thing as what you just said for a therapist visit, which I'm hugely believe in, a proponent of that. You know, I myself have done that, of going in person because it forces yourself also to be present. Since sadly we
yeah.
don't live in like a presenteeism world anymore, like just stopping, sitting, acknowledging someone you're walking by, or stopping, seeing someone in person, you have to be present. So video
Hmm.
has a way of having a lot of other distractions, phone, emails coming up, that you could be there but not really like 100% there as you're showing up fully.
Mm, hmm. Yeah, I love that. It's almost like you're reframing going to the doctor or taking time out
Hmm.
of the day, or making a tea as a self-care practice,
Hmm.
as you acknowledging yourself that you matter. Um, which that helps the person heal in itself, right? Hey,
Exactly.
hey body, I care about you. Hey body, I want you to be healthy. And it goes, okay, thanks.
Hmm.
Well,
Yeah,
I
and
know
whatever that
you've met.
is, could be a walk, a block around the block.
Yeah.
Yeah.
How simple is that? And I know you mentioned some stuff about around herbs and plant therapy. What's your idea, or what's your role on psychedelics, on integrated wellness and functional health?
So that's interesting because it's continuing to grow. And I think ketamine, for example, now is like very accessible for people compared to, let's say, like 5 or so years ago, in terms of access to that through psychiatry or their therapist. I myself have done ayahuasca. I did that in Costa Rica for a week, and that was a few years back after around 2021. And for me personally, it was really life changing. The funny thing is,
Mm,
I think I have the same thing that a lot of people say that get that do it. It's very hard to put it in words or to explain the benefit. But I know for me, after that year after, it felt like my life transformed. It like really,
mm,
it was something I needed at the time. But I did a lot of self work, I would say, for maybe 6 months to a year prior to going to it. It felt like it was almost like
yeah.
not my last step, because as people we're always should be growing, but it was like something that took me to a different space that I needed at that time. And even I remember my staff, when I came back, my clinic director said I felt like I was like floating for like 4 months. Like nothing bothered
Hmm.
me. I was like unfazed. It just put like life into perspective of appreciation, like I think for me, and like gratitude. And and then I feel like I just became more open from it, and just like a lot of things in my life changed after that. Relationships, what I wanted to do with my life, and kind of that like awakening. So I personally feel like I value it. But it's interesting because some people in the group that I went to come and get ayahuasca like every 3 months,
Wow.
or they do it several times a year. And the funny thing is, for me, I haven't went back since. And they say, they call it like the mother will like call you to come. So I've
Hmm.
sometimes had that interest, but I haven't. And I guess I get concerned if somebody has the need to do it that frequently. Are there other things that are being addressed? Like, are they still going to therapy? Because therapy is really powerful. Psychedelics also, they have been shown to accelerate healing. They even help with things like
Hmm.
neuroplasticity. It helps with the trauma piece, but equally, but biology is just important. The functional, piece of the person. Like, are we taking care of their infections that they had? Are we taking care of their inflammation? Are we taking care of the disease conditions on the back end? Because if we're not doing those can have equally contributing effects to someone's mental health. And if those will all come back if those have not been addressed, and you
Hmm.
can't address that, in my opinion, through psychedelics and therapy alone.
Mm. So it sounds like you're saying that the psychedelics can be multi dimensional in terms of the healing work they do.
Hmm.
Physically, emotionally, mentally. You didn't say it spiritually, but for me,
Oh,
that has
spiritually
been.
too. Yes.
Is there it sounds like maybe there's a disconnect you're referring to then, of like, you can go, and I've done ayahuasca in Peru a couple years ago, and,
Mm-hmm.
it was transformative, and I've never felt something that's healed me on multiple levels.
Mm-hmm.
But it sounds like you're saying there can be a disconnect between, okay, I go and I have this experience, but then I have to come back and somehow like integrate it into my physical life. Is that what
Mm-hmm.
you're hinting at?
Yes, you have to into your physical life, and like, what does that mean? And so that's why I know there are, and I forget the name of it. You probably know the name of it, Nick, where people are kind of after they have their therapy, you're actually, or psychedelic, like there's actually people who can walk through that, because now it's like, how
Hmm.
does that impact my life? How do I interpret what I experienced? What does that mean I change? And so I feel like it can't still replace like your biology, right? So yes, I
Mm.
have heard of some people who've had cases where they had, for example, Lyme disease, and they went, and then after that, they completely, their health completely made a turn, and they felt 100% better. But my question is like, how is it a year later? Did you fully resolve the piece, or was it like one level? I feel like psychedelics are several levels deep, as you mentioned. Also in that spiritual piece is like probably I think one of the biggest pieces to me. But when you do healing, that's often missed when we look at healing. They don't talk about, for example, your spirituality. And so I think it's getting you from that like strong root foundational piece, but physically and functionally, there are still a lot of other things that might need to be addressed that the psychedelics won't necessarily do. And so I think it's like,
Mm.
it's like one to me spoke of there's like a spoke wheels, and we have spokes of the wheels. It's one piece of many that I think needs to be. And I think if somebody has to keep going back continually for that, are there other aspects, like I just mentioned when we talked about medicine and getting that palliative fix of just here's your drug or here's the medication? In my opinion, with psychedelics, if you're still doing that in that way, are those other 10 factors being looked at that can
Hmm.
be equally beneficial for the person, or maybe hold them? Has that terrain been supported fully?
Yeah, yeah. I mean, I love what you're talking about. When I did ayahuasca a couple of years ago, I did 6 months of therapy on the front end and 6 months on the back end,
Mm-hmm.
and it was integrative. It was like someone, like you said, someone to walk with me into it, and then someone to help me integrate on the back end. It was almost like someone took my life in a snow globe and like shook it up. And then,
Mm-hmm.
as different parts of the snow, refell
It
down, it
followed.
almost layered down a new part of me.
Exactly.
Um, and interesting, I had a direct experience. I had pimples on my back for 10 years, right? And
Uh-huh.
just would not go away. And after going to Peru and doing a week of ceremony, that went away. And 2 years later, it's still gone. So that to me,
Oh,
it's like,
that's
wow, what
awesome.
it's like,
Wow.
but so it's interesting. It's like, was it that I did a clean diet for a month? Was it I removed alcohol? Was it that this healed something emotionally? This healed something spiritually? But on the physical plane, something went away that I'd struggled with for decades, and hasn't come back. I'm like, oh, that's to your point. It's like, oh, there must have been work there to integrate it that brought it down,
Hmm.
that got to the root cause.
And it could have been a trauma or some experience that was unaddressed that then got addressed
Mm.
through the psychedelics. Because you'll see, like in naturopathic medicine too, we what we call is like also a healing crisis. So I'll see sometimes when people get better is they start reverse ordering. I always say it's like peeling off layers of onion. And so
Hmm.
you'll start seeing they go backwards in time. It's really, really cool, actually, because I'll have some patients that I've gotten better, and they'll say, oh, they're, let's say, 35. And they're like, oh, I got some like outbursts of eczema. I haven't had eczema since I was like in my 20s. And then they'll say, oh, I started sleepwalking again. This is so like, it'll be 1 or 2 days. I'm like, I haven't sleepwalked since I was like a teenager. And then it's like, it's really cool because you'll see them going backwards. And then all of a sudden it's like they're done. So I feel
Mm.
like I've heard those stories too as well, where we had someone, like I said, that when I went for ayahuasca, where they got cured of illness, and they actually saw it was like an unraveling, like a yarn, where it was like going backwards, and it was like kind of unraveling, going back to like its initial form, or its like first form. So I definitely think that can happen. With many different, different therapies. The biggest thing is like, how do we sustain it over a period of time so it's not just something that's short lived for a year or two? But I think that's all part of like the healing crisis. And you probably, Nick, put a lot of work in before, when you talked about the skin piece, you probably already put a lot of pre-work in before
Hmm.
to work to fix that. And that could have been that final last step specific for you.
Yeah. Yeah. And I remember asking the shaman, I was having some issues, and I was having it's TMI, but I was having some like bleeding hemorrhoids while I was there. And I said, hey, should I do another round
Mm-hmm.
of ayahuasca? I'm having this. And he looks at me and he goes, of course, it's medicine. And just walked away. And it was so cool of someone who dedicated their life to this practice. He goes, you're here to be healed. How do we, so then what I'm sensing into now is that, let's say we have different ailments, physically,
Mm-hmm.
mentally, emotionally, spiritually. The work you're doing is, it sounds like helping the patient find out what realm that's in, or what body, whatever you want to call it. How do you start to find that out? Because I've had that, where I've had an elbow injury and I'm going at it through the physical world, but it doesn't heal. And then I realize it's a psychosomatic thing. So how
Mm-hmm.
do you hone in on where the disease or the illness is actually coming from?
I think it's funny because maybe you prompted me by talking about the shaman, because the funny thing is when I had my experience, I didn't go through fully my experience, but I actually had what's called the shaman. They were from Colombia. They called it a nada, which meant like nothing. So people were
Hmm.
having experiences when I was there, and guess what I did? I just had a great sleep. So I was knocked out every
Hmm.
day. It was like 5 days in a row. And I was so upset because I think I went up to like the maximum amount. And I'm like, am I not being, open minded? Am I not like, when am I blocked in that I'm not able to?
Hmm.
But when I would get up the next day, it was like, I felt amazing. So what they said is the nada is actually like a higher end of what you want to get to, because they said it's almost like anesthesia where you're knocked out and your body's like healing, because it could also be because there was so much trauma, like ancestral trauma, that you can't see it basically because it's too traumatic, that it's like
Hmm.
anesthesia, and then it's like working on you because the medicine, like you said, like is working all the time. But what the one big benefit I got, which was really interesting, was I got to talk to the shaman for like an hour and a half after. And why that was a huge benefit was that most people didn't get that opportunity, but he just felt like he had to give me like a message, that he had to talk to me. And so one of the things he said was that like I was a healer many times before. So that's why sometimes, going to your question, like it's almost like I know where to go with somebody. Sometimes it's like a feeling, and I can't
Hmm.
sometimes always explain that. And it's actually funny because we used to have there's a person that worked with in the office, and she's engineer. So she would have, every single piece be able to explain, why. And the hilarious thing was like sometimes we would always come often with like the same final answer, and it would be like, well, why, how did I didn't have to, it was just, this is what I think I should do.
Hmm.
And so some of it is, I think, from like clinical experience of seeing enough people for so many years that you just know, like, I think I need to go down the route of like the gut, or I think I need to go down the route of like environmental exposures or infections over time. And so, or, you go back and get their history of like, were they sick all the time as a kid? Okay, well, I've had people where they told me ever since I had mono as a kid, I felt like my health was never good after that. And guess what?
Hmm.
I do work on something called low dose immunotherapy for mono at that time, and then all their other healing stuff gets better, even though that might have nothing to do with what they're currently doing. So a lot of
Hmm.
times for me, I'm kind of going back to see like what is that change? Like when was that change in their health trajectory? What was that specific point in time? And then I go back to that oftentimes as like that's the root of where I might begin. But oftentimes too, it's like clinically where you're feeling like from what you've heard for stories, but then also like where that change in health started and what happened 1 or 2 years prior to that.
Hmm. Yeah, it sounds like you're getting pattern recognition
Mm-hmm.
over time through experience and through direct learning and knowledge and working with yourself. Um, as we're kind of coming in for a landing, I mean, I love how you've just shared that it's really hard for doctors to get to this level of awareness and knowledge.
Mm-hmm.
How does someone who's listening go find someone like you? If they don't live where you do,
Mm-hmm.
they live in San Francisco. How do they start to go down this path of finding the right naturopathic doctor for them that can actually help them heal in the way you're talking about?
Yes, yeah. So I'm a licensed naturopathic physician. I practice out of Connecticut. I do have a few states we're licensed in, and we do telemedicine. But if you want to find like a licensed doctor close to you in person, You would go to something called naturopathic.org. I'm actually also the current president of the American Association
Mm.
of Naturopathic Physicians, so the National Association, but that actually is a directory where you can find somebody in your area. But many doctors will have, like, they do telemedicine. Also, if there's a particular area, since most people don't come, unfortunately, we don't come just like, oh, I want to come for wellness. Most people are like, I have this and I want to come.
Hmm.
So the good thing
Hmm.
is in sites like this, or like, our practice, there might be certain specialties that you're going to look for, which many people do while they're still looking at the whole thing. You might come in for lupus, but you're still looking at all the other factors that could have contributed. But there are specialists for many different disease conditions that people have with naturopathic medicine.
Cool. So it's almost like start with what you want healed, and
Hmm.
that can kind of open the door to finding the right naturopathic doctor to help with
Exactly.
specific ailment. That's great. Yeah, how do our listeners reach you? How can they reach out for some of the work you do? What's the best way for them to
Yes.
learn about your
Yeah,
work?
sure. I just launched a YouTube channel, so I'll be doing a TED Talk later this year. So I'm trying to drive that up. So I'd love for
Congrats.
you guys to follow me on YouTube at Dr. Jaquel, Jaquel Patterson on YouTube. Also on Instagram, actually at naturopathic.physician. But those are the two places. Definitely YouTube is great, because the great thing with YouTube is you get to put 10 or 15 minutes of content and
Hmm.
education. So it's a great place to learn, and learn more about my work and some of the areas that I focus on.
Great. Well, I will put those in the notes for sure. I may reach out for some of the things I have going on that I haven't been able
Oh,
to
for sure.
to heal myself as I've been getting more mature in my age, and I like to say getting older. That's so great. Thank you so much for your time. We'll put this out, and for everyone listening, if you felt like this was impactful, if this helped you, we don't advertise on this show. All we ask is that if it resonated with you, share it with your friends, your family, and someone who you think could benefit from this conversation. And that is how we elevate the health, the wealth, the peace, and happiness of this world, one conversation at a time. So, Jaquel, thanks so much for being on. It's been great, and I really appreciate your time and knowledge.
Thank you. Thank you for having me.
Absolutely.